Welcome back. You're watching SA Today on SABC News. Let's take you to the World Health Organization. There is currently a briefing on the latest COVID-19 pandemic developments. Let's take you through to Dr. Tedros and the team.
First, assess the current outbreak situation in your country based on the latest data you have at hand. Conduct honest analysis and consider the good, the bad, and the ugly. I have a specific message for those countries that have successfully brought COVID-19 transmission under control. Now is the time to double down to keep transmission at a low level. Be vigilant, be ready to identify cases and clusters and take quick action. Do not allow the virus to take hold again. Second, for those countries where cases, hospitalizations, and ICU rates are rising, make the necessary adjustments and course correct as quickly as possible. Making changes when needed shows leadership and strength. Third, it's important to be clear and honest with the public about the status of the pandemic in your country and what's needed from every citizen to get through this pandemic together. Fourth, put systems in place to make it easier for citizens to comply with the measures that are advised. This means if people are told to isolate or quarantine or businesses have to close temporarily, governments need to do everything they can to assist individuals, families, and businesses. Fifth, the next few months for many people will be difficult. There are incredible stories of hope and resilience of people and businesses responding creatively to the outbreak, and we need to share this widely. Governments need to carry out the basic steps of speaking to people who are infected with the virus and their contacts and giving them specific instructions on what to do next. If governments are able to hone their contact tracing systems and focus on isolating all cases and quarantining contacts, then mandatory stay-at-home orders for everyone can be avoided. We have seen many times from around the world that it's never too late for leaders to act and turn the outbreak around. Key to a united front against the virus is sharing resources equitably. Oxygen is one of the most essential medicines for saving patients with COVID-19 and many other conditions. Many countries simply do not have enough oxygen available to assist sick patients as they struggle to breathe. I'm going to talk to you about what WHO and partners are doing to fill the global oxygen gap. Estimates suggest that some of the poorest countries may have just 5 to 20% of the oxygen that they need for patient care. Through the pandemic, the demand for oxygen has grown exponentially. Back in June, when there were approximately 140,000 new COVID-19 cases a day, the global need for oxygen was estimated to be approximately 88,000 large cylinders each day across the world. As daily cases rise around the world to over 400,000, the need for oxygen has gone up to 1.2 million cylinders each year, just in low and middle income countries alone, which is 13 times higher. Early in the pandemic, WHO's approach was to scale up oxygen in the most vulnerable countries by procuring and distributing oxygen concentrators. This led to over 30,000 concentrators, 40,000 pulse oximeters, and patient monitors to reach 121 countries, including 37 that are classified as fragile. This includes installing pressure swing adsorption plants, or PSS, that would be able to cover the supply needed for a large hospital and district health facilities in the area. Somalia, Chad, and South Sudan had to rely exclusively on oxygen cylinders from private vendors that are often traveling long distances and come with a high price tag. WHO is working with the Ministries of Health in these 3 countries to design oxygen plants fit for their local needs, which will result in sustainable and self-sufficient oxygen supply. WHO is committed to working in solidarity with all governments, partners, and the private sector to scale up sustainable oxygen supply. The Oxygen Project reflects WHO's commitment to end-to-end solutions and innovation to do what we do better, cheaper, and reach more people. For example, we're working with partners to harness solar power to run oxygen concentrators in remote places where electricity supply is unreliable and to reduce costs. One of the main barriers to medical oxygen is the high transport costs of cylinders to the health facilities. In Kenya, a private sector company has positioned oxygen plants near clusters of health facilities and uses a milk delivery system to deliver oxygen to more than 140 clinics. Incentivizing the business sector to change its approach and model is key to ensuring sustainable oxygen in low and middle-income countries. Asante sana, Kenya. And to be successful, the health workforce needs to be ready. Not only doctors and nurses with experience in caring for severely ill patients, but also biomedical engineers, respiratory therapists, and maintenance staff. Oxygen saves lives of patients with COVID-19, but it will also save some of the 800,000 children under 5 that die every year of pneumonia and improve the overall safety of surgery. A better world means ensuring oxygen is available for all, where they need it and when they need it. Tomorrow marks World Polio Day week, and partners around the world, led in particular by Rotary International, are organizing events and raising awareness about the need to eradicate polio. Over the summer, the world collectively welcomed Africa's historic success of ridding the continent of wild polio virus. Thanks to hundreds of thousands of health workers reaching millions of children with safe and effective vaccines across the continent, the world celebrated one of the greatest public health achievements of all time. However, while there is polio anywhere, the world remains at risk of resurgence. Following suspension of polio and routine immunization due to the pandemic, vaccination drives have now been restarted. We applaud and encourage governments for doing catch-up campaigns so that no child is left behind, and we can soon consign polio to the history books alongside smallpox. Smallpox eradication, as you know, is a remarkable achievement, not least because it was completed at the heart of the Cold War. Health did then and should now always come above politics. And it's with sadness that this week we lost one of the great titans of smallpox eradication with the passing of Dr. Mike Lane. Dr. Mike Lane spent 13 years chasing down the last remnants of smallpox, finding cases and vaccinating communities in some of the remotest corners of the earth, where smallpox was still endemic. At CDC, Dr. Lane was the last program director of the smallpox eradication program and received many awards, including the U.S. Public Health Services Commendation Medal. For many years, Dr. Lane was an advisor to WHO on smallpox. I wish to express my deepest sympathy to Dr. Lane's friends and family. We will continue to honor his legacy. Finally, telling stories is as old as human civilization. It helps us understand our problems and can inspire action that changes lives. WHO is proud to announce the second Health for All Film Festival to cultivate visual storytelling about public health. Submissions are open for tomorrow to 30th January 2021. We look forward to receiving original short films from across the world. More details are available on our website. I thank you.
Thank you, Dr.
Circuit for the Reuters live service.
Open the floor to questions from journalists. I remind you that you will need to raise your hand, use the raise your hand function in order to get in the queue to ask your question. I will start by inviting Carmen Pone from Politico to ask the first question. Carmen, can you hear me?
Yes, Fadela, thank you so much for giving me the floor. I have a question about remdesivir. The FDA announced that they are giving a full approval to it yesterday. And given what we were discussing last time about the solidarity trial results from remdesivir, people may be confused with the two developments. So I wanted to ask, I assume Dr. Soumya Swaminathan, what does this mean? What normal people, that are not following these developments very closely should know about these two separate developments, the solidarity trial results and the FDA announcing full approval for the medicine. And also last time you were mentioning about the guidelines that are still being developed by the WHO group, specifically designed to that. Can you give us a timeline on when you expect them to release their recommendation about remdesivir use or not? Thank you so much.
Thank you, Carmen. Dr. Swaminathan will answer this question.
Thank you, Carmen, for that question. And you've raised an important issue, but let me start by saying that the Solidarity trial is a randomized clinical trial that was looking at 4 different drugs that were considered to be promising early in the pandemic in February, March. These were all repurposed drugs. And when we presented the results, it was a trial results. Now, the trial results are used both by guideline developers as well as by regulators to make decisions about how and when and where best to use these drugs. So the guideline development process in WHO is a distinct, separate process that has begun, and Dr. Janet Diaz is here. She may say more about that and the timelines later. The regulatory approvals are yet another set of processes, and regulators look at data that companies provide to them on efficacy and safety and of course on the manufacturing processes as well before they give approval. And there are different types of approval. As we know, remdesivir was given an emergency use authorization a few months ago, and that's done in the case of an emergency in a pandemic, for example. It's based on very preliminary data, and it's essentially a temporary measure while more data is being accumulated. So what we understand from the FDA decision yesterday was based on data submitted to them from Gilead, which did not include the Solidarity trial results. We have submitted the Solidarity trial results to Gilead. They first saw the results on the 23rd of September and then saw the full manuscript on the 28th of September. So they did have the results even before they were made public through medRxiv, because we give it to them 10 days in advance. So it appears that the Solidarity results were not considered, were not provided to the FDA. We believe that it is the largest trial in the world globally. 5,000 patients were randomized to either remdesivir or standard of care. We looked at very important endpoints, in-hospital mortality, no difference. Progression to ventilation, so people who came in, 92% of people who entered this trial, were randomized to this trial, were not on mechanical ventilation. So they were either not on oxygen at all or they were receiving oxygen. So we looked at how many of those progressed to need ventilation, exactly similar numbers in the remdesivir and the control arm. and same for the other drugs that we tested. And then we also looked at proportion of patients who got discharged at the end of 7 days of hospitalization. And we found that when we compared remdesivir with some of the other drugs like hydroxychloroquine or lopinavir, there was no difference in that proportion compared.
All right, that is the WHO briefing that is currently underway there. Very importantly, Dr. Tedros pleading with countries to be clear and honest about status of the pandemic in their countries. Very important indeed there. Well, that's it from myself, Flo Ledwaba, and the rest of the team here at SA Today. Thank you very much for tuning in this Friday afternoon. I'll be back with you on Sunday afternoon. Take care. Enjoy the rest of your Friday evening and certainly your weekend too. Cheerio.